Chronic kidney disease, symptoms and treatment. Chronic kidney disease is a gradual loss of kidney function over several years. At first, there are often no symptoms, but it can cause high blood pressure and swelling due to fluid retention. It can eventually lead to kidney failure. Chronic kidney disease affects about 35.5 million people in the United States, which is approximately 14% of the population. It often goes undetected and undiagnosed until the condition is well advanced. As kidney disease advances, dangerous levels of waste can rapidly build up inside the body. Treatment aims to stop or slow the progression of kidney dysfunction by controlling the underlying cause. Watch on to learn more about chronic kidney disease, including its causes, symptoms, and treatments. Symptoms. People who are at high risk of developing chronic kidney disease should have regular kidney function checks. Early detection can help prevent severe kidney damage. Chronic kidney disease is a slow and gradually progressive condition that causes kidney dysfunction. However, if one kidney stops functioning correctly, the other may still carry out normal functions. A kidney may deteriorate to a certain level of dysfunction and not get any worse. Sometimes, however, the condition may progress to kidney failure. Most people with chronic kidney disease are not aware that they have it because symptoms do not usually develop in the early stages of the condition. Typically, by the time a person notices any symptoms, the condition is at an advanced stage. Damage to the kidneys is irreversible. Symptoms of chronic kidney disease can include hypertension or high blood pressure, anemia, edema or swollen feet, hands and ankles, fatigue or tiredness, decreased urine output, bloody urine in some cases, dark urine in some cases, decreased mental alertness when the condition is severe, a loss of appetite, persistent itchy skin when the condition is severe, more frequent urination, especially at night in some cases. Causes. Kidneys carry out the complex system of filtration in our bodies. This involves removing excess waste and fluid material from the blood and excreting it from the body. Kidneys filter toxins and waste from a person's blood. However, problems can occur if the blood flow does not reach the kidneys properly, if the kidneys are not working properly because of damage or disease, if an obstruction prevents urine outflow. Chronic kidney disease often happens as a result of either diabetes or hypertension. When a person has unmanaged diabetes, sugar or glucose accumulates in the blood and can damage the kidneys. High blood pressure, meanwhile, can damage the glomeruli. These are parts of the kidney that filter waste products. Some other causes of chronic kidney disease may include obstructed urine flow. Blocked urine can back up into the kidney from the bladder. Blocked urine flow increases pressure on the kidneys and undermines their function. Possible causes include an enlarged prostate, kidney stones, and a tumor. Kidney diseases. There are many different kidney diseases including polycystic kidney disease, pyelonephritis, and glomerulonephritis. Kidney artery stenosis. This causes a narrowing or blockage of the renal artery before it enters the kidney. Heavy metal poisoning. Lead is a common source of poisoning. Fetal developmental problems. This can occur if the fetus kidneys do not develop correctly in the womb. Systemic lupus erythematosus. This is an autoimmune condition wherein the body's immune system attacks the kidneys as though they are foreign tissue. Malaria and yellow fever. These two mosquito-borne diseases may cause impaired kidney function. Certain medications. The overuse of certain drugs, including non-steroidal anti-inflammatory drugs, can lead to kidney failure. Illegal substance use. Using substances such as heroin or cocaine can damage the kidneys. Kidney injury. Sustaining a sharp blow or another physical injury to the kidneys can cause damage. Treatment types. People may need to take many medications to treat the symptoms and conditions that develop due to chronic kidney disease. In addition, a person may need to try one of the following lifestyle changes or treatments depending on the stage of their chronic kidney disease. Diet. Following a proper diet is a vital part of kidney failure treatment. Restricting the amount of protein in the diet may help slow down the progression of the condition, as consuming too much protein may overexert a person's kidneys. However, the specific amount of protein a person should eat depends on their body size, overall health, and exercise regimen. A person should talk with a doctor or dietitian to find out the best sources of protein and how much to consume. Non-steroidal anti-inflammatory drugs. People with chronic kidney disease should avoid non-steroidal anti-inflammatory drugs such as ibuprofen, certain antibiotics, and the use of dye with a CT scan. This is due to an increased risk of side effects as a result of how the kidneys may metabolize these drugs. End-stage treatment. End-stage treatment typically begins when a person is at stage 5 and their kidney is functioning at 10 to 15% of its normal capacity. It occurs when the kidneys cannot keep up with the waste and fluid elimination process despite the person making lifestyle changes, making dietary changes, and taking medications. For this reason, a person with end-stage renal disease will need dialysis or a kidney transplant to survive. Most doctors try to delay the need for dialysis or a kidney transplant for as long as possible because they can lead to potentially serious complications. Kidney dialysis. Dialysis is the mechanical removal of waste products and excessive fluids from the blood when the kidneys can no longer carry out this function. Dialysis has some serious risk, including infection. Kidney transplant. A kidney transplant is a better option than dialysis for those with no other health conditions apart from kidney failure. However, candidates for a kidney transplant may have to undergo dialysis until they receive a new kidney. A kidney donor and recipient need to have blood types that work together. If a person receives a kidney from someone with incompatible blood, their body may reject it. Siblings or very close relatives are usually the best types of donors. If a living donor is not available, the search will begin for a cadaver donor, and a person will get a kidney from someone who has recently died. Complications. If chronic kidney disease progresses to kidney failure, complications can include anemia, fluid retention, gout, heart disease, hyperkalemia, which is when blood potassium levels rise, possibly resulting in heart damage, metabolic acidosis, which is when acid builds up in the body, secondary hyperparathyroidism, which is when vitamin D, calcium and phosphorus levels are out of balance. Prevention. Some conditions such as diabetes increase the risk of chronic kidney disease. Controlling diabetes can reduce the risk of developing kidney failure. Individuals should follow their doctor's instructions, advice and recommendations. Diet. Eating a healthy diet can help a person lower their blood pressure. Some heart-healthy foods include fruits and vegetables, whole grains, lean meats. Physical activity. Getting regular physical activity is ideal for maintaining healthy blood pressure levels. It also helps control chronic conditions such as diabetes and heart disease. Individuals should check with a doctor about whether or not an exercise program is suitable for their age, weight and health. Avoiding certain substances. Excessive alcohol and drug use, as well as long-term exposure to heavy metals such as lead, fuels, solvents and other toxic chemicals can contribute to kidney disease.